Treatment plan for partially edentulous patient. The mouth preparation. The mouth preparation for the partially edentulous preparation include all the preparation or procedure that taking to modify the intraoral tissue, which are the teeth, abutment teeth, residual ridge, the soft tissue, for the proper setting of the partial denture. The preparation of mouth for removable partial denture includes two criteria. The first criteria is the pre-prosthetic mouth preparation and the prosthetic mouth preparation. For the pre-prosthetic mouth preparation include all the procedure that doing for the mouth preparation before making the prosthodontic treatment, which include the relief of pain and infection, oral surgical procedures, conditioning of abused and irritated tissue, in addition to periodontal therapy, correction of occlusal plane, orthodontic correction for the malpose teeth, splinting of weak teeth or periodontally compromised teeth, in addition to reshaping of the teeth for proper plane of insertion and preparation of the rest and guiding plane. The prosthetic procedure or the prosthetic mouth preparation include all the steps for making the removable partial denture, which include the impression techniques for removable partial denture, designing of the removable partial denture, and the fabrication of removable partial denture. The procedure or the prosthetic procedures for the mouth preparation first of all begin with the relieving of the pain and infection. Most of the pain in the teeth before the making prosthetic treatment is due to the carious teeth, and the carious teeth should be restored. And in case of the teeth with the pain or acute pain, should be endodontically treated to relieve any pain or discomfort. Asymptomatic teeth with deep carious lesion should be treated for relieve any chronic pulpitis in the future. In addition to the gingival disease, such as presence of gingival abscess, especially in the abutment teeth, acute necrotizing ulcerative gingivitis should be treated before doing any prosthodontic treatment. Calculus and plaque accumulation should be removed. Another procedure, which are pre-prosthetic procedure, is the oral surgical preparation. The oral surgical preparation include the extraction of the teeth, especially the poor prognosis teeth. The poor prognosis teeth include the poorly or grade 3 mobility teeth. In addition, if there is an impacted teeth or severely malposed teeth that cannot be corrected by orthodontic treatment. In addition, the poorly prognosis teeth include the teeth that cannot restored by any restorative treatment, such as the filling endodontic treatment. Other surgical procedure that should be doing before the prosthodontic treatment is the removal of residual ridge, because the presence of any residual root, removal of the residual roots, because any residual or retained roots that that remain during the prosthodontic treatment cause pathology or cyst under the retained root. In addition, the pocket in the abutment teeth when the residual or retained root is adjacent to the abutment teeth. The cyst or any odontogenic tumor should be removed and taking biopsy for investigation. Exostoses such as the tori, the palatal tori or mandibular tori, if it is large or excessive, should be removed by surgical treatment because the tori is covered by a mucosa and may cause irritation during wearing the partial denture. Hyperplastic tissue such as the fibrous tuberosity should be removed because its effect on the stability and setting of the partial denture. Other surgical procedures include the muscle attachment and freni. In case of extraction of the teeth, the alveolar ridge is resolved, and the loss of height of alveolar ridge may cause detachment of the insertion of the muscle, especially the mylohyoid muscle, buccinator, and mentalis, and genioglossus muscle. For the mylohyoid muscle, the severe resorption of alveolar ridge cause more prominence of the mylohyoid ridge, and in this case, the mylohyoid ridge should be relieved by surgical treatment. In addition, to reposition the mylohyoid muscle because it interferes with the lingual border of the mandibular denture. The mentalis muscle and genioglossus muscle. The mentalis muscle affect on the labial flange of the mandibular partial denture, and during the severe resorption of alveolar bone may cause interfering with the setting and stability, retention and stability of the partial denture. The genioglossus muscle, when there is a severe resorption of the alveolar ridge, the genial tubercle may be prominent and cause irritation and severe sensation for the patient during the wearing of the removable partial denture. Surgical preparation that needed before the prosthodontic treatment include the bony spine and the knife edge ridge. For the bony spine or any bony excess of the alveolar ridge should be removed because it affects on the retention and stability of the partial denture. For the knife edge ridge, the surgical procedure for making the knife edge residual ridge is round from the knife edge shape to round shape for better stability and retention of the removable partial denture. But in this case, you have to keep in your mind the rounding of the knife edge residual ridge should be as minimum as possible, removing of the bone, because here we need for much bone for the stability of the denture. And when there is a severe resolved alveolar ridge with knife edge, after rounding of the knife edge with the surgical procedures, we have to make deepening of the vestibule for more bone for retention and for more extension of the border of the partial denture. Another surgical preparation or surgical procedure is doing for patients with dentofacial deformity, such as the cleft palate, that should be corrected before the prosthodontic treatment, or correction of any defect in the maxilla or in the mandible before any prosthodontic treatment. Some cases of the removable partial denture may need for osteo-integrated devices, such as the implant, for more supporting or give more support for the removable partial denture, in addition to the augmentation of the alveolar bone with hydroxyapatite crystals or artificial bone added to the alveolar bone before making the prosthodontic treatment, for augmentation of the alveolar bone for more retention and more stability of the partial denture. Any hyperkeratotic or erythroplasia or ulceration should be treated before any prosthodontic treatment. Or some cases with blood discreases that causes and tissue will have a burn sensation and inflammation of the soft tissue of cheek, lips, or the tongue, or the mucosa that the covering the alveolar bone may be inflamed due to the diabetes or blood discreases or anemia or iron deficiency or presence of previous poor fitting denture, and in addition there is a distortion of the normal anatomical structure, such as the rugae of the palate, in addition to the crest of the alveolar bone. The burning sensation is another symptom of the abused or irritated tissue. The treatment in these cases is include two parts. The first part is the home care, and the second part is the using of tissue conditioning material. For the home care, the patient is instructed to rinse his mouth with the prescribed saline solution 3 times daily, in addition to making massaging for the residual ridge area with a soft toothbrush, and if he have a previous poor fitting denture should be restored with a new one, and remove his prosthesis during the night, in addition to using a prescribed therapeutic multiple vitamin drugs to give more build-up or more to eliminate the inflammation and irritation of the soft tissue. Another procedure for the treatment of abused or irritated tissue is the use of tissue conditioning material. The the tissue conditioning material is an elastomeric polymers that put on the tissue surface of the removable partial denture and flow to an extended area and permit more time for the irritated or abused or distorted tissue to rebound and resume or assume their normal form. For the application of the tissue conditioning material, first of all, you have to make adjustment for the occlusal plane of the partial denture and remove any high spot, then removing 2 to 3 millimeter from the tissue surface of the removable partial denture to give space for the tissue conditioning material to be coating or applied to the tissue surface of the removable partial denture, and should be inserted intraorally with the removable partial denture and replaced every day to give the chance or permitting a period of time for the abused tissue to be healed. After the healing of the abused tissue or the irritation tissue, the tissue conditioning material should be removed, and making a new good fitting partial denture should be inserted for the patient, in addition to correction the other causes or management of the other causes of abused tissue, which include if there is a nutritional disturbance, the patient have taking a multivitamin drugs, and in the case of diabetic patient should be controlling his diabetes mellitus, and patient with blood discharges such as the anemia should be treated to eliminate any future occurrence of the abused tissue or irritation in the tissue. The other phase of the preparation of the mouth before the making prosthodontic treatment is the abutment teeth preparation. The abutment teeth preparation, as we mentioned before, should be treated if there is any acute pulpitis or any caries in the abutment teeth, and should be treated periodontally if the periodontal weakening in the abutment teeth should be treated before any preparation for the abutment teeth. The preparation of the abutment teeth include 3 steps of the preparation. The first step is the making the guiding plane or insertion guiding plane of the partial denture parallel to the proximal surface of the abutment teeth to produce a single path of insertion for the removable partial denture for easier insertion and removing of the removable partial denture. And in this case, the two abutments or the proximal surface of the two abutment teeth should be have a parallel path of insertion or parallel proximal surface to give a single path of insertion of the removable partial denture. And in this case, the proximal surface, if there is a large undercut cervically, the height of the contour of the tooth should be reduced by a cylindrical diamond pair after making the surveying for the cast or on the study cast, and determine the amount of the proximal surface that should be removed, and after removing of or reducing the height of the contour in the proximal surface to produce parallel guiding plane or parallel path of insertion of the removable partial denture by the diamond pair should be polished to produce polished surface and reduce any caries formation in the future. The other procedure for the abutment tooth preparation is to preparing the height of contour of the tooth for the correct position of the reciprocal arm of the removable partial denture and the retentive arm of the removable partial denture. The height of contour after surveying of the cast should be reduced in a manner that the reciprocal arm should be at the height of the contour or above the height of contour at the middle third of the abutment tooth, while the retentive arm, the terminal part, should be gingival to the junction between the middle and gingival third for more bracing of the retentive arm to the abutment tooth and more aesthetic appearance of the retentive arm when the patient is talking or during the smiling of the patient. The third preparation is to preparing the abutment tooth for the correct position of the occlusal rest by preparing the occlusal seat of the removable of the occlusal seat of the occlusal rest of the removable partial denture. The occlusal seat of the occlusal rest, this is the occlusal rest, and the position of the occlusal rest in the abutment teeth should be called the occlusal seat. The occlusal rest should be recommended to sit directly in a degree less than 90 degree to produce a direct and applying of occlusal force to the long axis of the abutment teeth, and the junction between the occlusal rest and the proximal plate of the removable of the framework should be rounded to decrease any fracture of the occlusal seat, and the end of the occlusal rest should be have a spoon shaped or rounded spoon shape inside the occlusal seat of the uh, abutment teeth to reduce any fracture of the occlusal seat in addition to more or perpendicular occlusal force to the long axis of the. And thank you.